Thank you. Welcome, everyone. Thank you so much for joining us today. Before we get started, we have a few housekeeping items for you. First, a quick reminder that this webinar will be recorded and it will be made available on YouTube later this week. Second, you should now be able to turn on the closed captioning or the live transcription feature on Zoom, which is located on the toolbar at the bottom of your screen. Finally, we would also like to encourage you to ask questions via the Q&A function. We want this to be a conversation. We'll be sharing these questions with the team during the Q&A portion of today's conversation. So with that said, let's begin. Again, thank you for joining us. My name is Sylvia Gonzalez. I am co-director of research at the UCLA Latino Policy and Politics Institute, or LPPI, where I oversee our research docket at the intersection of climate change, environmental justice, and health. For those that are not familiar with the Institute, LPPI was launched about 7 years ago. So we're a relatively young organization, but it was launched with the belief that there is no American agenda without a Latino agenda, and that every issue is a Latino issue, be it immigration, access to the ballot box, healthcare, or the topic of today, which is the increasing threat of pollution, climate change, extreme weather events to the health, safety, and prosperity of Latino communities. At a time when our community is being forced to be invisible, today we are proud to share the Latino Climate and Health Dashboard, a new tool designed to make data on climate risks and health disparities in Latino communities visible, accessible, and actionable. Our briefing today will begin with remarks from Dr. Arturo Vargas Bustamante. He is Faculty Director of Research at LPPI. Arturo will provide an overview of this tool, why it was created, how our advisory committee shaped its development, and 3 key findings that highlight the urgency of this work. Next, we'll have a live demo by Julia Silver. Julia is the program manager of the dashboard and a senior research analyst at LPPI. Julia will walk us through the different components of the fact sheets that are on the Latino Climate and Health Dashboard, which will help us understand the disparities between Latino and non-Latino white neighborhoods in California. Then we'll hear community perspectives from 2 of our key partners in this project. First, Mar Velez of the Latino Coalition for a Healthy California. Mar will speak to how climate and health inequities show up in her work and the critical role of community involvement in shaping tools like this one. Second, Leticia Clasen Rodriguez of the Socio-Environmental and Education Network will share how local data can fill advocacy gaps and service gaps, and how organizations and coalitions can put this tool to work to advance environmental and community health. Finally, we'll close with a Q&A, which will begin after Leticia's remarks and will be moderated by Chris Rivera, who's Communication Manager at LPPI. And because great speakers deserve to be introduced not just once, but twice, here's another chance to see the fantastic folks that you'll be hearing from today, but now with pictures. Thank you again for being here. We look forward to this important conversation. Arturo, over to you.
Thank you, Sylvia. Good morning, everyone, and thank you for being here. My name is Arturo Vargas Bustamante. I'm a professor of health policy and management at the UCLA Fielding School of Public Health and the faculty research director at the UCLA Latino Policy and Politics Institute, or LPPI. Before we begin, I want to take a moment to acknowledge the ongoing challenges and unrest we've seen here in Los Angeles and in communities across the country. These events are a reflection of the deeper structural issues that continue to affect Latino communities, issues shaped by longstanding patterns of neglect, underinvestment, and systematic barriers. With this in mind, today we are proud to officially launch a new resource that we know can make a real difference for communities, policymakers, researchers, and advocates across California: the Latino Climate and Health Dashboard. This is a public, easy-to-use tool that brings attention to one of the most urgent health challenges in our state: the unequal impact of climate change and pollution on Latino communities. The dashboard brings together neighborhood-level data from 23 California counties, where 93% of the state's Latino population lives. It allows users to explore and download fact sheets focused on 2 major health threats: air pollution and extreme heat. It includes over 30 indicators from more than 10 public data sources, covering things like pollution exposure, asthma-related emergency room visits, the number of extremely hot days each year, and more. All of this is presented with one goal in mind: to show how climate and environmental risks are directly affecting the health of Latino neighborhoods. At LPPI, we know that policies must be grounded in the real-life conditions of the communities they are meant to serve. We created this dashboard because we saw a critical gap. Latino communities are too often left out of the data that shapes environmental and health policy. And when communities are left out of the data, they are left out of the solutions. This tool is not just for highlighting disparities. It's about providing practical information that can support action, organizing, and accountability. From the beginning, this project had two major goals. First, to bring together strong data that supports what many in our communities already know, that Latino neighborhoods are on the front lines of climate and health risks. Second, to make that data clear, accessible, and usable to support storytelling, advocacy, and better decision-making. To help guide the development of this tool, we worked closely with an advisory committee made up of community advocates, researchers, public health experts, and environmental justice leaders. Their insights helped us decide what to include, how to frame it, and how to make it relevant for those working on the ground. Now, I'd like to share just a few top-line findings that show why this work is urgent. Latino neighborhoods in California experience 60 extreme heat days a year. That's 23 more days than non-Latino white neighborhoods. Many households lack air conditioning or the resources to cool down, increasing health risks. Latino neighborhoods are exposed to twice as much air pollution as non-Latino white neighborhoods. This exposure is linked to asthma, heart disease, and premature death, and it affects our communities every day. As a result, Latino neighborhoods have twice the rate of asthma-related emergency room visits compared to non-Latino white neighborhoods. These numbers reflect what many already know from daily life. The burdens of climate change and pollution are not shared equally. We created this dashboard with a clear purpose: to power change. We hope this tool will be used by community groups organizing for cooling centers, tree canopy investments, or clean air in schools. Policy staff drafting stronger protections or making targeted investments. Researchers studying environmental and health trends, and journalists and storytellers helping connect the dots between exposure and public health. This is more than a website. It's a platform for visibility, accountability, and advocacy. Before I hand things over for a walkthrough of the dashboard, I want to thank the incredible team that made this work possible. This project came to life thanks to the hard work of LPPI's research, communications, mobilization, and administrative teams. Thank you to our advisory committee for helping shape this effort with care and clarity. And sincere thank you to our founder, the California Wellness Foundation, whose support made this vision a reality. Now, I'll pass it to my colleague, Julia Silver, Senior Research Analyst at LPPI, who will walk us through the dashboard and show how it can be used. Thank you.
Thank you. Hi, everyone. Thank you for taking the time to be here today. As Dr. Bustamante mentioned, my name is Julia Silver, and I'm a program manager of the Latino Climate and Health Dashboard and a senior research analyst at the UCLA Latino Policy and Politics Institute. This is the Latino Climate and Health Dashboard. The heart of our dashboard is our climate and health fact sheets for 23 California counties, featured here on the map. The 23 counties that we have fact sheets for are shown in the teal color. We do not have fact sheets for the gray counties because of their low Latino populations. For this iteration of the dashboard, we are focused on counties with high Latino populations and Latino neighborhoods. We'll take a closer look at the fact sheets in a moment. Our fact sheets, as mentioned, primarily present data on Latino neighborhoods. So you may be thinking, what is a Latino neighborhood? First of all, we use the word neighborhood to talk about census tracts. The U.S. Census Bureau defines a census tract as a geographic area with a population ranging from 2,500 to 8,000 people. Census tracts are often representative of how we understand neighborhoods. In our dashboard, we primarily define Latino neighborhoods as any neighborhood that has a population of 70% or more Latino individuals. People of other race or ethnic groups live in Latino neighborhoods, but these neighborhoods are supermajority Latino. In our fact sheets, we also present data on non-Latino white neighborhoods. We primarily define non-Latino white neighborhoods as any neighborhood that has a population of 70% or more non-Latino white individuals. We compare Latino to non-Latino white neighborhoods to help highlight how systemic inequities show up across communities. It's not about creating divisions, rather about showing how place, race, ethnicity, and policy intersect. You may also be wondering, why study neighborhoods in particular? Well, studying neighborhoods allows us to uncover disparities that we can't uncover at the individual level, given limitations in data availability and resources. However, the data can tell us, for example, how many extreme heat days are experienced in different neighborhoods. Therefore, understanding population characteristics of neighborhoods enables us to uncover disparities by neighborhood type and across different kinds of neighborhoods. Additionally, exposure to climate conditions is a very localized experience. In Los Angeles County, for example, we see stark differences in extreme heat exposure between Latino and non-Latino white neighborhoods. Coastal communities, where non-Latino white neighborhoods are concentrated, experience far fewer extreme heat days in comparison to inland areas like the San Fernando Valley or East LA, where Latino neighborhoods are concentrated. That said, let's turn back to the map of California. As you can see here, we offer fact sheets on both extreme heat and air pollution. We decided to explore these two topical areas because of data availability and accuracy, relevance to Latino communities, and input from our advisory committee and community partners. If you have suggestions for other topical areas you think that we should explore in future iterations of the project, please do let us know in the Q&A or via email. So running with my last example, let's take a look at our extreme heat fact sheet for LA County. Here again is the Latino Climate and Health Dashboard homepage. To find the LA County Extreme Heat fact sheet, we can hover over the county and click their respective icon, or we can scroll down to the county list and search what we're looking for. Once we click the icon, the fact sheet will open in a new tab. Our fact sheets are 2 pages and aim to present data points in the simplest, most accessible way possible. Here at the top of the first page, we present county statistics to give our users a better understanding of the factors that can influence one's exposure to extreme heat. This section provides some foundational information about socioeconomic outcomes of Latino and non-Latino populations in each county. Research has shown that these indicators are associated with the ability to mitigate exposure to extreme heat. On the bottom of the first page, we present neighborhood statistics on extreme heat. We define extreme heat days as any day when the temperature is at or above 90 degrees Fahrenheit. We include a map that presents neighborhoods' exposure to extreme heat days and how that compares to the county and state averages of extreme heat days. As you can see here in the legend, the lightest color represents those neighborhoods with 0 extreme heat days annually. The middle color represents those neighborhoods that experienced a number of extreme heat days below the county average. And the darkest color represents those neighborhoods that experienced a number of extreme heat days that was above the county average. The slotted areas on the map represent Latino neighborhoods. As I mentioned earlier, we can see that Latino neighborhoods are not concentrated in the areas with 0 or below average extreme heat days. You can see that areas such as the San Fernando Valley or Antelope Valley have concentrations of Latino neighborhoods and are primarily shown in the darkest color, again, meaning that they experience more annual extreme heat days than other places in LA County. To the right of the map, we include some indicators that help us better understand extreme heat outcomes, including the annual number of extreme heat days, consecutive extreme heat days, and the projected number of extreme heat days. For LA County, we can observe that in all cases here, Latino neighborhoods have been and are projected to be more exposed to extreme heat than non-Latino white neighborhoods. This has implications for the health of those neighborhoods, considering that overexposure to extreme heat poses risks such as heat stroke, dehydration, and heat stress. On page 2, we first present barriers and facilitators to preventing heat exposure, including data on tree canopy, impervious surfaces, and older housing units. As these terms and concepts can be confusing, we offer brief definitions and add context to make meaning out of the data for users. For example, under tree canopy, we note that tree canopy is land shaded by trees, and that less tree canopy or fewer trees means increased exposure to extreme heat. Thus, by looking at the data points here, we can see that the percentage for Latino neighborhoods is lower than the percentage for non-Latino white neighborhoods, meaning that Latino neighborhoods are more exposed to extreme heat related to tree canopy. Similarly, under older housing units, we note that more older homes equate to an increased exposure to extreme heat, considering that older homes often have poor insulation and HVAC systems. Looking at the data points, we can see that the percentage is higher for Latino neighborhoods than it is for non-Latino white neighborhoods, again, meaning that Latino neighborhoods are more exposed to extreme heat. We then present data on vulnerable groups. Starting with age, we mentioned that children and older adults are at higher risk for heat-related illnesses and present data about each of those groups. We next present an indicator on workers in heat-exposed industries, seeing that there are about 3 times more heat-exposed workers in Latino neighborhoods than in non-Latino white neighborhoods. This is concerning for the health of individuals in those Latino neighborhoods. Speaking of health, we then present some indicators about the relationship between extreme heat exposure and health outcomes, noting that extreme heat poses serious health risks, especially for people with conditions like heart disease, asthma, diabetes, and obesity. These individuals are more vulnerable because heat places extra stress on the body, worsening symptoms and increasing the risk of medical emergencies. We can see that in all cases here, Latino neighborhoods have worse health outcomes. There are more adults in Latino neighborhoods with both diabetes and obesity than there are in non-Latino white neighborhoods. Similarly, there are more emergency room visits for heart attacks, asthma attacks, and heat-related concerns in Latino neighborhoods. The fact that these neighborhoods have worse health outcomes has serious consequences when it comes to exposure to extreme heat. Chronic conditions reduce the body's ability to regulate temperature and respond to heat stress. Higher rates of these conditions in Latino neighborhoods means that more people are at an increased risk of heat stroke, organ failure, or even death during extreme heat events. These data points accentuate the compounding risk that Latino neighborhoods face. Last, we present data about disadvantaged communities, which are defined by the state of California under Senate Bill 535 as areas that are burdened due to environmental pollution and population characteristics. We include this indicator since our organization, the Latino Policy and Politics Institute, focuses on conducting research for policy change. We see that 88% of Latino neighborhoods are categorized as disadvantaged, while only 3% of non-Latino white neighborhoods are. Ultimately, this fact sheet tells a story. Across almost all of the indicators we present, Latino neighborhoods experience disproportionate exposure to extreme heat and related health conditions. Generally, across counties, this story holds true. As mentioned earlier in the presentation, we also have fact sheets on air pollution, which tell a similar story of disproportionate exposure for Latino neighborhoods. We encourage you to take a look at those fact sheets after this community briefing. To take a step back and look at the dashboard at large, we also have a section on impact, which contains subpages on research, news, and our partners. Further, we have an About section that includes an FAQ, more information about our data, our team, and our formal technical documentation. Our FAQ provides some easy to understand answers to foundational methodological and logistical questions, such as how is an indicator calculated and where are the indicators sourced from, to how should I cite the Latino Climate and Health Dashboard. To learn more about our specific indicators and data sources, you can click the Our Data tab. You can filter by category, such as health outcomes and conditions. You can also filter by fact sheet. As you'll see, we provide brief descriptions and sources of all of our indicators. Last, we have a resource directory of other organizations working at the intersection of health and climate. We invite you to explore all of these subpages to learn more about this initiative. We want to accentuate that the Latino Climate and Health Dashboard is built for action. We want it in the hands of community organizers and advocates pushing for heat centers, tree canopy, or clean air investments, legislative staff looking for data to prioritize frontline communities, and storytellers who can help the public better understand how systemic disinvestment still plays a role in our neighborhoods. From here, I will pass the floor to Marta Velez, a member of our project's advisory committee, to offer her perspective. Thank you.
Hi, everyone. My name is Mar Velez, Director of Policy with the Latino Coalition for a Healthy California. And I want to thank LPPI for inviting LCHC to speak on the dashboard today. A little bit about LCHC. We are a policy advocacy organization at a statewide level. Our mission is to protect and advance the health of Latina and Indigenous Californians. And we do this through two main ways. One is policy advocacy. So we either support or oppose legislation to ensure that Latinas and Indigenous Californians are really obtaining the best possible health outcomes. And then we also have a programs portfolio at LCHC, and that includes a youth program. It includes a health justice fellowship for recent graduates. And then we also have a trusted network of promotoras de salud throughout the state. And they're located in several different parts of California, including Los Angeles, San Diego, San Bernardino, and Sacramento. And so for us at LCHC, we do focus on two main policy areas. One is health access, which I think you can think about as being able to see a doctor, right? A fundamental part of health is being able to see a physician when you're sick. And the other is social determinants of health. And you'd be surprised, but only 20% of health outcomes are dependent on healthcare access. The other 80% is really dependent on the social determinants. So where we live, where we play, where we go to school. And that's why this dashboard is so important, particularly in this moment as we're seeing in California, so many more of these climate change impacts really affecting the Latina community. For us at LCHC, we really leverage this type of data when we meet with legislators. And so if you take a look at the dashboard, I think we learned a little bit about what's happening in LA County, for example. And what we're seeing is that in these counties that are heavily Latina, for example, LA County, 49% Latina, the impacts of climate change are disproportionately impacting Latinos and Latina communities. For example, in LA County, we're seeing that Latina neighborhoods are experiencing 25 extreme heat days compared to 8 for non-Latina white neighborhoods. So that is no surprise, right? That is no surprise for many of us that live in these communities. And the additional information that the dashboard offers also includes things like uninsurance rates, poverty rates, food insecurity rates, and you'll see that they're all aligned in terms of those kinds of issues impacting Latinas disproportionately. And I do have to add, in this moment where we're seeing the Latina community being impacted by, violent immigration, deportations, ICE raids, et cetera, that this type of information is really important to also uplift because our communities are experiencing compounded, issues. We know that as we approach, the summer, that many folks right now, because of immigration raids, are choosing to stay at home, right? It's dangerous for them. They don't know if they'll come back home. And so as we enter the summer, I think we're all concerned about what increasing temperatures, how they might impact immigrant communities. And so it's our job at LCHC to really uplift this issue with our state legislators, our decision makers. And that's when we really have to leverage this data, but also pair it with the community voices and the community stories that are in these neighborhoods, right? At LCHC, we work with legislators to support policies and legislation that will advance the health of Latinas and Indigenous people. LCHC leverages this kind of quantitative research that LPPI has pulled together with the climate and health dashboard, and we pair it with the human experience. We know that legislators are often being asked for many different things, are getting a lot of different information. And so this dashboard really offers, the data in a way that is really digestible, in a way that is really accessible. And again, with these community stories, I think that's the winning combination to make sure that legislators really truly understand what Latinas, what Indigenous folks are experiencing at the ground level. And again, we're seeing many more climate change disasters impacting our communities, increased extreme heat, the fires only this January, floods in the Central Valley a few years ago. And so legislators have a duty to address climate change, but they must do this equitably. And with tools like this dashboard that really highlight the specific impact for our communities, I think this really tells that complete story. And so really appreciate LPPI pulling this together and looking forward to leveraging this in our advocacy at the state level.
Hello, everyone. Thank you so much. It is an honor to be able to support this work today. I'm Leticia. I'm the Participatory Science Director at SCENE. And so I work at services rural communities across the San Joaquin Valley, from Merced County to Tulare County, many of which specifically in the San Joaquin Valley are farm workers suffering bad air quality, water quality, and intense heat conditions. And my role is to support community-led research. And so when I joined the advisory committee, because this dashboard perfectly aligns with SCENE's and my personal mission of bilingual data democracy. And so at SCENE, our goal is to break down barriers to data accessibility through non-extractive educational opportunities relevant to air quality, water quality, climate impacts, ecological monitoring. So this dashboard makes complex health and climate data accessible to Latino communities who need it the most. And so in our work, centering community means moving from about communities to with communities. When we train residents to test their own water for nitrates or monitor their air quality, they become co-authors of their environmental story. And so not just research subjects. And this dashboard follows the same philosophy of putting data directly in community hands. This dashboard represents the same shift that we looking to create when community members take their water test results to city council meetings, or they look at an online map of their air quality and they know when it's a good time to go out and when it's not. That knowledge gets woven directly into policy conversations instead of just being interpreted by outside researchers. So this can become an essential tool for grassroots community-based organizations such as ours that want to use monitoring data, but also train communities in monitoring data for their community efforts. And so data democratization in practice, for example, can you pass the slide, please? Our passive air quality monitoring creates data that communities can understand and act on. This dashboard extends this power. Instead of waiting for academic studies, Latino communities now have real access to localized health and climate data that affects their daily lives. And I also want to highlight that this dashboard will be a living collaborative resource. So being updated with available data, which really, really umps our game in research and advocacy. So for communities and grassroots organizations, this means more resources for a true, meaningful, non-extractive engagement with communities. Another example, our water quality monitoring trains community members to be their own environmental scientists. And so serving as a template for our work, this dashboard has the potential to give communities the tools to advocate for themselves. It's not just about extracting data from communities, it's not about extracting data from communities. It's about giving them the power to use the data for a change. And so when community members show up for their own nitrate test results, they can't be dismissed, in some policy meetings. And then this dashboard is a great potential for giving them that same power with climate and health data, county-specific evidence that makes their lived experiences impossible to ignore in policy spaces, or hopefully that's the goal. So through our workshops, we train community leaders. Our organization is based of scientists and community leaders and educators. So we're all working together and collaborating with other organizations to be able to make sure that we can distribute resources and ensure that research these research resources are getting to communities and then it's being used and they can be a part of it. So all that to say that I'm really immensely proud of this Rockstars team that has worked so hard to develop this. And I'm looking forward to see how we can apply it in our work. Thank you.
Thank you so much, Leticia. That concludes today's presentation portion of the briefing today. We will now begin our Q&A. Reminder, you can use the Q&A function to type out any questions. I've seen a number of you have been asking questions throughout the briefing thus far. I will ask that all presenters unmute their camera so we can all see you again. And then we can get started on our Q&A. Great, so we'll start off. I have a question here for Arturo. Why did LPPI prioritize the development of a Latino-focused climate and health dashboard? What was the gap that you were trying to fill?
As I mentioned in my introduction, we do see that out there's like lack of research of a focus on Latinos, particularly in states where Latinos are now a majority, like California. We know that a lot of these different populations cluster in certain neighborhoods and communities. So it was important for us to precisely identify these disparities based on these neighborhoods and showed how wide the disparities were within the state. So we took advantage of the data that was already produced in order for us to put together this dashboard that will make those differences clear for everyone. And as we all mentioned, like community leaders, policymakers, advocates will be able to use this data in order for us to find solutions on how to address this disparity.
Thank you for that, Arturo. Another question here. how do you hope policymakers and public institutions will use the dashboard in the months ahead? And I think Sylvia may be best to answer this one.
Oh, absolutely. As Arturo said, this is more than just a website. This really is a tool for accountability. And so we're hoping that decision makers will use the Latino Climate and Health Dashboard to identify where climate and health inequities are concentrated, where they can target resources, where they're needed the most, especially at a time where our budget is in, difficulty here in California. Also, there's, I think, an opportunity to strengthen proposals. If you are, for example, a nonprofit organization and you're preparing a proposal to a funder, there's an opportunity for you to use that data to strengthen your proposals with evidence. And so I'm also hoping that policymakers will be able to craft policies that really reflect the lived experiences of Latino communities. And so our goal is to really support data-driven action that advances climate and health equity for not just Latino communities, but for all communities.
Thank you, Sylvia. And a question for Julia. Can you give us a preview of some of the indicators featured in the air pollution fact sheet series?
Yes, of course. So in the air pollution fact sheet series, we start by presenting county statistics, just like we did in the extreme heat fact sheet series. From there, we present indicators on air pollutants such as particulate matter 2.5 or PM 2.5, as well as diesel particulate matter. We also provide a map in that fact sheet series that displays neighborhoods' exposure to PM 2.5 and how those levels compare to each respective county average. From there, we present indicators on proximity to major sources of air pollution, such as cleanup sites, hazardous waste facilities, and RMP facilities, providing exposure or proximity scores for each. We also have a section on vehicle types and traffic to provide some context to see how Latino neighborhoods fare in relation to lower emission vehicles, clunker vehicles, and traffic density. We also have a section on health, which has indicators such as chronic condition rates and ER visits for asthma. And then we wrap up the fact sheet series with the same section on disadvantaged communities, and notice that across all 23 counties, we do tend to see that Latino neighborhoods experience disproportionate exposure to air pollution in comparison to non-Latino white neighborhoods.
Thank you, Julia. And I have a question. I think this will be best for Rosario. Could you share a little bit about some of the challenges in making this dashboard both data-rich, but also user-friendly for non-research experts?
Yeah, sure. So, hi, my name is Rosario, and I was part of the data team for creating this dashboard and for putting together all of the indicators that are included in the fact sheets. And so, some of the challenges that we faced early on, as Julia mentioned, is that given the nature of a lot of these indicators at the census tract level, they're not available at the individual level. And so we can't tell you, for example, that Latinos in LA County experience X amount of extreme heat days in the same way that we can tell you the median household income of Latinos in LA County. And so our solution for overcoming this and being able to tell both a regional story, but also a story of disparities, was to categorize census tracts or neighborhoods into types based on their population composition. We also looked at our final count included 35 indicators, but in total we considered somewhere between 40 and 50. And so there was a lot of data to come through and to consider for what would ultimately make it into the fact sheets. And so we leaned a lot on the members of our advisory committee to help us really narrow down on what would be most relevant and most impactful to our users. But yeah, that was some of the challenges that we experienced. And then a lot of iteration, a lot of feedback to make sure that the data was accessible and told a coherent story.
Thank you, Rosario. And we have a question teed up here for both Mar and Leticia. Mar, if you want to go first. The question is, how can we most effectively use these fact sheets to advocate for change in our communities?
Yeah, of course. I think I mentioned at LCHC, we have our network of promotoras de salud. They really are the boots on the ground, so to speak, that really are in touch with the community. What are some of the most pressing health issues that our community is experiencing? And I think something that I love about our promotoras is that they are actually really interested in the facts, in the data. They want to know, what are the percentages of homes that have air conditionings? Wait, we need more, or how can we make this more affordable, etc. And so I think for me, this dashboard is so amazing in the sense that it has the information right then and there, and we can walk our promotoras through this information. Does it reflect the lived experience of the community? How can we really bring this data to life and really make sure that, again, decision makers, people that are in positions of power understand the impacts? And so we come back to that really important combination of quantitative and qualitative, where we are leveraging this data and really pairing it with the lived experiences of our community, to make sure that that is a complete picture for legislators to understand.
Thank you, Mar. I think you said it perfectly. I think from our experience, we also work providing educational workshops that are intergenerational. And so, like Mar said, a lot of our community leaders or organizers that are very interested in facts, and they want to be more, they want to have an active participation in what is happening. And so, for example, it allows us to have more capacity to provide more materials. So this is something that we can highlight and we use in our workshops, and then help share with the communities, give them another source of where to go and gather information. And also, we work also with other smaller nonprofits or community-based organizations that they want to apply for funding and climate resilience funding, and that's something that we have also worked with organizations. And so it's just more information and something that really back it up, because this is a world that is moved by data, and I think it just gives more power to support these anecdotes and their lived experiences. I think Mark covered everything else pretty well.
Thank you, Leticia and Mar. And I have a question here. I've seen it asked a couple of times in different ways. This will be for Sylvia. What about Latino neighborhoods that are not meeting the 70% threshold in the census tract, but let's say are 35 to 70% of the residents? Is data available on these Latino neighborhoods?
We do have data on these Latino neighborhoods, but we decided to focus on the 70% threshold because we consider those places to be racialized. So the probability of really being a Latino in that place is really high. And so we wanted to capture that bigger experience of Latino communities across the state. But we do have data. And if there is interest in seeing that data, please reach out to us. We're happy to work with you to explore that data.
Thank you for that. And next question I have here is coming from Justine Calma, reporter with The Verge. Our question is, can this tool help fill in for gaps left after the Trump administration took down environmental justice screen and other climate and environmental justice resources from federal web pages? How can tools like this help communities who lost those federal resources? And Arturo or Sylvia, is this something you want to try to answer?
Yeah, I can get started. Yes, of course, we try to obviously keep this issue in the headlines. And as Leticia mentioned, we want to provide facts from like reliable data sources. And we don't want this to be something that gets erased from the policy sphere. So absolutely, that's one of our intentions. Of course, we don't have the resources that the federal government has. And we cannot sustain big data sources that in order for us to be able to keep the same like level of information that you were able to get from federal sources. But with what we are able to do, I think that's one of the main aims, keep this issue top in the agenda and provide reliable information that will be useful for the community change. So what do you think, Sylvia?
Yes, we did actively archive a lot of the data sources that were erased from federal websites, and we do have a different ongoing advocacy project to make sure that state agencies in California continue to produce that data, even if there isn't a federal mandate to produce the data that was used in these data sources that were erased. And so while we don't directly use them right now, we do have access to them, and we can do research with them in the future.
Thank you so much, Arturo and Sylvia. I have a question here for Julia. Is the dashboard community friendly, language and access, or are there specific for providers?
Thank you for that question. We definitely want to accentuate that the primary audience of the Latino Climate and Health Dashboard is advocates, is the community members. So just for some context as well, as we were iterating on the different versions of the fact sheets, we received an integrated feedback from 40 to 50 community-based organizations around the state of California, and really wanted to kind of keep our eye on the prize with this dashboard because of the fact that so many of the data resources that we're pulling from at their foundation are not accessible. These concepts are not friendly to the community. And so really our team had tunnel vision on making this a community-friendly dashboard. That's why, as I was mentioning in the presentation, or the demonstration rather, that for some of these concepts like tree canopy or impervious surfaces, right, those aren't household names. People don't know what those are. And so we try our best to provide these brief, easily understandable definitions and to make meaning out of the data so that the community can really use this dashboard and these fact sheets as a grab and go. You know, Latino neighborhoods experience X% of this indicator, and be able to use that information and data points to really advocate for change in their communities. So yes, definitely the community was centered throughout the entire process of the development of this dashboard.
Thank you, Julia. We have a question here from Natasha Ludwig-Barron from UCSF. It was mentioned a couple of times about the ICE raids impacting community health. Do you have any studies, qualitative, quantitative, that is looking at how ICE raids are affecting health of Latinos in California? I think this is something maybe Mar might want to answer.
Yes, of course. Yeah, that's a really great question. We don't have any specific quantitative data, but I can tell you that from the first Trump administration, there have been a lot of studies that have showed that immigrant communities, Latina communities, have dropped in terms of enrollment into safety net programs like Medi-Cal, like CalFresh and SNAP. And so we can only assume that, cutting off access or choosing not to enroll in these programs due to fear of things like public charge and those things impacting immigration proceedings, et cetera, will only lead to decreased health outcomes for immigrant communities. We can say, based on conversations with our clinic partners, that many of their immigrant patients have actually canceled doctor's appointments, getting medication, out of fear of being picked up by ICE during this really tumultuous time for immigrant communities. So again, right now we might not have that quantitative data, but we're definitely hearing from our community partners, our clinic partners, about the impacts. And folks are unfortunately, not foregoing care, delaying care. I think there was just an LA Times article, and in the story, it showed that a woman was not getting her diabetes medication and was only living off of tortillas and coffee. So these are the real stories, the suffering that is, being implicated upon our communities because of these rates. So yes, there is definitely a public health impact, that is being experienced because of these rates by our communities.
And to follow up on Mar's response, I think that our dashboard will be incredibly useful in the future because it will act as a baseline where you can, for example, see ER visits in certain communities. And if you later match with data from communities targeted by ICE, and then you will see an increase in those ER visits, that potential increase could be due to people delaying going to the ER because of fear to those ICE rates, and potentially getting worse outcomes over time because they delay care. So I think this dashboard will definitely inform not only the climate change and environmental debate, but also what are going to be some of the main consequences from these rates.
Thank you so much, Arturo. Next question here comes from Roxanne. How can this data be overlaid with health access data? The state is deciding this week on policies to freeze immigrant new enrollments, intentionally create financial and bureaucratic barriers for those who are currently enrolled. Arturo or Sylvia, is this something you want to take a stab at?
Can you repeat the question?
Yeah. How can this data be overlaid with health access data? I think is the main question. A bit of context, the state is deciding this week on policies to freeze immigrant new enrollments, for example, and intentionally create financial and bureaucratic barriers.
Yeah, that would be similar to what my previous response was about the ER. Like ultimately, we would expect not only that the rates are gonna discourage eligible immigrants from going to preventive care or the ER, but the policies that are right now being discussed about freezing funding for medical or undocumented immigrants could also have similar effects. So at the end, we will be able to compare what is that effect from these policies at the timing when they happen with future data on ER visits, on healthcare access and use, and on physician visits in the previous year.
Yeah,
Thank you.
I could just quickly add as well. I think in the fact sheets, there is an indicator there around uninsurance rates. And so I found that information very helpful. And I can just see that if these, and unfortunately, I think these proposals will go through to freeze and to require premiums for undocumented Californians on Medi-Cal. I can see that uninsurance rate in those fact sheets increasing in the coming years.
Thank you, Arturo and Mar. Rosario, question for you. I think this was kind of asked, but maybe you can also chime in here. What about Latino neighborhoods that are not meeting the 70% threshold in the census tract, but are, let's say, 35 to 70% of the residents in the census tract? Is data available on those Latino neighborhoods?
Yeah, so that's a really good question. So for the sake of our fact sheets and for this iteration, we decided to focus on neighborhoods that were a large or supermajority of Latino residents. And so that's why we set the 70% threshold. However, that doesn't mean that Latino threshold can't be defined by 60 or 65% threshold or even lower. And so we do acknowledge that there are counties who have Latino neighborhoods that meet lower thresholds. And so yes, data is available for those neighborhoods, and we do provide detailed information in our technical documentation about how it is that we created these neighborhood types. And so either in future iterations, we might explore lower threshold, or if individuals or organizations are interested in replicating our methods, but for a lower threshold, we do encourage you to check out our technical documentation to learn more information about how it is that we approached our analysis.
Thank you, Rosario. And that will conclude the Q&A portion of today's briefing, and I will pass it back to Sylvia to close us out.
Well, thank you so much, everyone. This wraps our briefing today. First, I want to extend a heartfelt thank you to those that are just taking the time to be with us to learn more, and to our community partners for taking time from their busy schedule to share some of their experiences with the data dashboard and how they use data in their work. A special thank you to all of the incredible LPPI staff that are working behind the scenes. We don't get to see them, but they're the ones that make this possible. Lorena, Ana, Alberto, I know that you're there somewhere. Also, we invite you to explore the Latino Climate and Health Dashboard. I'm going to ask one of the team members to please drop the link in the chat, but you can also see it on your screen. Use your phone to access the QR code and it'll take you directly to the website. Also, your partnership is key in ensuring that this tool has impact. So we encourage you to reach out if you have any questions or if there's opportunities for partnership to amplify this work, either through your networks, through social media and newsletters or upcoming meetings and events. We're here as a resource. Please reach out to us. We're happy to support. We look forward to keeping in touch. And that's all for today. Thank you so much.